The doctors knew that it was Gypsy the entire time. It was her behavioral problems that were causing her to fake her illness. And I'm not talking about the actual things that she has with her chromosome problems, but everything else, the doctors accused Gypsy, not Dee Dee. So let's talk about it. I was reading through them and then I noticed something interesting. When the doctors were typing their notes, it was a pretty common occurrence where it said that Gypsy would refuse to eat or drink whenever she was sick. She would tell the doctors, not Dee Dee, Gypsy would tell the doctors that she wasn't getting better with treatments. And speaking of Dee Dee, she would say that she's happy with the results. If something was normal or not significant, she was fine with that. In the HBO documentary, they wanted to say that there was a doctor that said Dee Dee was a bad historian. Why? Because Dee Dee told them that. She was the one that said that. It wasn't because they thought that. As a matter of fact, if you look up at the very top, it says, this was from a speech therapist doing a swallow study. She had significant gagging and coughing with inconsistencies, but the speech therapist felt that some of this may have been behavioral rather than a true swallowing dysfunction. That means they thought it was Gypsy. It literally was Gypsy the entire time. But they want to spin the story. Yep, Gypsy said she's attending school, she returned from Louisiana, but she gets out of breath really quickly. It says the patient has exhibited significant difficulty swallowing with all the consistency of the food. There's significant gagging with each attempt to swallow. Only small quantities were swallowed without spitting out the food. For example, right here, for a hearing test, it says Dee Dee was happy that Gypsy passed her hearing test and didn't really want to mess with it. She would just do allergy medications. Weird. It was also Gypsy here that said that after a breathing treatment she received that she still wasn't doing any better. Not Dee Dee, it was Gypsy. You can read it right here in the medical records. So, used to do in-clinic procedures, so they had to put her under. She didn't tolerate them well, that means she threw a fit. So they had to put her under general anesthetic. Isn't that so crazy? Somebody with Munchausen syndrome by proxy does not accept a normal diagnosis for anything. And if you go through those records, you will see over and over and over again that Dee Dee was totally cool with it. If it was normal, she was like, bet, like that's great. So it was Gypsy the entire time. I guess I would say dramatic, making things out to be worse than what they actually were, saying that treatments didn't work, breathing treatments didn't work. It was never Dee Dee. Gypsy doesn't like it, but I'm actually just saying it because it makes sense. The first video that she reported of mine was in regards to the school. I had shared a clip of her reading her book. I brought up some screenshots along with the clip of that video, and it was taken down and the sound was removed by the owner of the sound. So that would be Gypsy. So let's just recap on that. There was multiple reports of her going to school. There's one from the Ronald McDonald House where it says she was in a Catholic school, and various reports throughout her medical records where it says she was registered through Brock Elementary. And for whatever reason, she did not like that, and so I had to take that video. And for whatever reason, I guess because I'm talking about theories of mine that other people haven't really brought up as much, she does not like that. So I'm guessing I'm getting kind of close, but she's probably not gonna like this one either. Did a doctor diagnose Gypsy Rose Blanchard with having disturbed behavior? So I'm gonna show you the record and I'll let you decide, or if you are a medical professional and you can provide some insight, I would appreciate that, because it's kind of looking like Gypsy has a medical history of acute severe behavioral disturbances. And also just a gentle reminder that if you are not already following me, if you enjoy seeing my videos and you want to see more of them, I try to be different and focus on different aspects of cases and the little details that people seem to just skip over. That's really my thing because I'm weird, but yeah. So if you enjoyed these videos, hit the follow button and let's go. This is all alleged for educational purposes only. So we've got the date of April 2007 highlighted at the top, and then if you look to the left, ASBD, and then I believe that says stool control. It might say something else. The handwriting's a little rough. And then GER, which I think that's the gastroesophageal reflux. P&D, I'll show you what that one means, and it says improved, I believe, and then needs a new pediatrician. So she didn't even have a pediatrician at the time. But let's get into what these acronyms actually stand for because I looked them up to double check. And although I've taken like some nursing courses when I was in school because I was gonna be a CNA in high school, I'm pretty familiar with medical terminology, but this one I needed to look up. And immediately what popped up is acute behavioral disturbance or acute severe behavioral disturbances. It is the sudden onset of aggressive, violent behavior in hyperadrenergic autonomic dysfunction, hypothermia, tachycardia, usually in the presence of acute on chronic drug misuse or serious mental illness, also known as excited delirium. ABD is a medical emergency with a 10% risk of sudden death. Patient restraint in ABD should be kept at an absolute minimum, rapidly followed by sedation with intramuscular or intravenous benzodiazepines, antipsychotics, or ketamine, and accompanied by monitoring of vital signs. Restraint in the prone position must be avoided. Symptoms can include agitation, violence, self-harm, can be caused by a number of things, including mental health conditions, substance use, infection, neurodevelopmental disorders, often requires immediate medical intervention to prevent or reduce harm. Treatment may include verbal de-escalation. If that fails, oral or parenteral medications. It's common in children and adolescents and is usually treated in the ER. It can also result in anaphylaxis, which would explain the need for Gypsy to have an EpiPen. So she could have got so agitated and started behaving so erratically that it triggered an anaphylactic shock. The P&D is an acronym for paroxysmal nocturnal dyspnea, a medical condition that can cause a person to suddenly wake up short of breath while sleeping. P&D is characterized by a sudden feeling of breathlessness that wakes a person up, often 1 or 2 hours of sleep. The person may gasp or cough and may sit or stand up to try and breathe better. P&D can be frightening and distressing. The report from that study indicates that it was mildly abnormal, with evidence of mild nocturnal hypoventilation with no evidence of significant central sleep apnea, obstructive sleep apnea, or nocturnal hypoxemia. The end-tidal carbon dioxide was in the low 40s to the low 50s throughout most of the study. Gypsy appears to have really quite mild asthma and rhinitis, which she got a lot of steroids that really helped that. And it seems well controlled. Her nocturnal episodes of coughing, gagging, gasping, I think are most likely due to impaired swallowing mechanisms described above, which you can see that. And yeah, you can read the rest of it. According to the doctor that did like the swallow functioning and the lung functioning test, they said it was a behavioral issue with Gypsy. Not wanting to do it correctly, not wanting to hold her mouth correctly, or that she couldn't. She had there was issues with it. But they blamed it on Gypsy's behavioral issues, and afterwards, whenever they said everything was mild, in their record, it says Claudine was satisfied with Gypsy being on allergy medicine. That is not typical for Munchausen by proxy. And you can see here, this is the muscle biopsy study that she had done, which shows, which you cannot fake these because they take a literal piece of the muscle and look at the tissue to see what it looks like. It says she had type 2 fiber atrophy. So is it possible that Gypsy's mom, Dee, said muscular dystrophy instead of muscle fiber atrophy? Especially because she said she has memory issues and is just not familiar with the word. Or maybe she did say that and they misunderstood her. So I think a lot of it is that the doctor blamed these issues on Gypsy because they could see that she would try to interrupt tests to verify whether something was or wasn't working, or if there was an issue with something, and Gypsy would interfere with those tests by doing things on her own. Because every time something was normal, Dee Dee was like, great. But I looked up alternative meanings for that acronym, and the only other thing that came up was like the Australian Society of Breast Disease. And I really doubt that was in Gypsy's medical records, so I'm led to believe that this was an acute severe behavioral disturbance. And that could also possibly describe the reason why Dee Dee had an EpiPen, like an epinephrine pen, on hand for an allergic reaction, like an anaphylactic where your throat starts to swell up shut and you can't breathe. And it could have been Gypsy just initiating that behavior herself by getting so worked up and so agitated and angry that she triggered that in her own body. I don't know that it's purposeful doing that, or maybe it is. I'm not entirely sure, but there's a fun fact about the whole like allergy thing where she would say she wasn't allowed to have sugar or she was allergic to milk. In the medical records, it says that Gypsy was the one that felt, like telling this to the doctor, Gypsy felt she was allergic to milk. And then her mother agreed with her. So Gypsy was the one that said that, not Dee Dee. And that's why after she did what she did with Nick, to her mom, Gypsy immediately had milk to drink at the Waffle House. Because you can hear it in the interrogation with Nick, she forgot she was allergic. Or she just didn't care anymore because she didn't have to make her mom think that she was allergic or felt she was allergic. She never thought she was allergic. And plus, it literally said in the medical record that she drinks Pediasure like 4 or 5 cans a day, and that has milk in it. And everything that she pretty much ingested had milk, but that's why it doesn't make sense. And when I read this, I thought it was so funny because when I was younger, I have an older sister who's about 2 years older than me, and she would get anaphylactic shock just randomly, and like her throat would swell shut, and so we'd have to, well, not we, but like my dad would have to use the EpiPen on her. My dad became convinced that it was because of cheese, that she had a cheese allergy. And so he made it to where she could absolutely not eat any cheese whatsoever. So she'd be eating cheeseless pizza and all this stuff. And then he wanted to take her to an allergy specialist or whatever. And they were describing that they had to do they would poke you with a little bit of it on there and see if it has a reaction. He was like, no, that's stupid, because then it could make her go into anaphylactic shock again. And so she never got allergy tested for it to see if she was actually allergic to the cheese. And so she had to go years without eating any cheese in front of him. Of course, she would do it when he wasn't around and nothing happened. But she would always have to eat the craziest stuff because she couldn't have any cheese. And eventually she grew out of it. So it's just so funny. She hated her life because she was she loved chips and queso. She couldn't eat it. She loved, nobody wants to eat just pizza without cheese. Nobody does. And so she really just, that was the worst time of her life. And it was just a coincidence that she was eating cheese at those times, because she pretty much ate cheese almost at every meal, just about. But yeah. Stupid. Anyway, I don't know, again, I'm not a doctor. If there's any medical professionals watching this video, I would appreciate it if you would weigh in and say if this acronym means something different. I don't know, especially with the reports of Gypsy's behavior when she was younger and, she threatened another child. I wouldn't be surprised if she did have a history, a diagnosis in there. That's just my opinion, and obviously she's got some disturbed behavior issues, clearly, but drop your thoughts below. Don't forget to follow me, and I will see you guys later. Bye, y'all.